My name is Matthijs van der Lucht. I'm a physiotherapist at the trauma unit, Unit 44, Foothills Medical Center. I believe it to be the most special and exciting unit at Foothills Medical Center, but that's my personal taste and preference. And the reason why is it's the complexity. It's the variety. We get complex musculoskeletal injuries, multiple fractures, we get neurological injuries where the spinal cord or there's a traumatic brain injury involved in this case. Often organs are involved as well. We need to have a look and see what the function is of heart and lungs. So the diversity makes it very interesting, and there's many cooks in the kitchen. In this case, you end up working with so many different specialists, physiatry, trauma surgeons, spine surgeons, neurosurgeons, on and on and on, which makes it a lot of fun. That makes it multidisciplinary. And for me, because I have so much affinity with biomechanics, physiology and anatomy, I get to brainstorm and be creative with all these different parts of my job every single day. Never a bored day. And I was with Cirque du Soleil, doing that for a long time and traveling around the world as well. This is different, though I have to say trauma is almost the same as circus. There's so many people coming together, having to be creative and empowering people.
My favorite unit? I do like vascular because the amputees are very interesting. You get a lot of complex patients. There's never really a dull moment. You can get some strong personalities, but you can get that anywhere. So over there, I'd say it's the most variety and the most interesting. It's also the only vascular unit in Calgary, so it's unique to this hospital. But I do enjoy the pace and the workflow on ortho. And it is quite unique because in both, a hip fracture or an amputation or kind of anything major like that, the wins are really big when you get them. So regardless of what I'm treating, I like those two because the wins are pretty huge and the impact you can have on people is pretty big. A lot of times you're one of the first people who sees someone after a pretty catastrophic injury or pretty catastrophic life event, and they are mentally and physically at some of the lowest points of their life, and you're a big piece in building them back up, both like mentally and physically. So the wins are really big. You get a lot more happy tears here than you do in private practice. Partially is the type of work I like to do, but more so the big wins.